Welcome back to Data Nerds, our new segment presented by Reading Rehab. We got our third episode going today, labeled as ACL repeated isokinetic training, testing, and adaptation. I'm Pat Healy. I'm the case leader for this episode, joined by I'm Reese's Puffs because this is a serial testing episode. We're doing serial testing. All right, who am I joined by here?
Mike Brown as Captain Crunch.
And Brian Gardner as Applejacks.
Shockingly, no cinnamon toast crunch. I am blown away. Usually that's a crowd favorite. Cereal testing. No, not the cereal you eat, but in terms of repeated testing over a given period of time. So the case, if no one has seen it's only on YouTube right now, so you would have to watch it. Episode 1 of our Data Nerds for isometric testing of the same individual that we're going to be talking about today. If you have not seen it, just a quick recap. This is a mid-30-year-old gentleman who works for the fire department and had ACL reconstruction and revision done back in 2012. And he came presenting with knee pain and challenges with daily activities, and especially ones that involve deeper knee flexions and activities that involve deeper knee flexions, such as cutting and things as like running downhill when he's like going for trail runs and other things such as like that. So to get you up to speed, I've been seeing this gentleman 2 times a week now since his initial eval. And every session we end with isokinetic training, specifically for eccentric knee extension. This patient, like I said, has his greatest difficulty through knee flexion angles between 55 to 70 degrees, which you'll see here in a little bit. As a little disclaimer, since his second session with me, I have decided to begin NMES with him for both his open kinetic chain and closed kinetic chain exercises that bias knee extension, just to try to get a little bit more juice, just because if you go back and see the isometric testing episode, his deficit side to side is quite significant, to where essentially throwing the kitchen sink at it to try to just get the best results possible. So it's not like, it's just like an 11 or 12%. Like this thing was wide. Okay. So what did we do for the serial testing / training? So this was completed in CPM mode, which means continuous passive motion. And I set his range of motion for 10 to 90 degrees of knee flexion. And the patient essentially rests as he's being brought into extension. And when it goes into flexion, he will resist it. And we were doing 3 sets of 6 reps with just a minute between sets. And I'll get into more specifics of the movement in the next slide after this.
Can I ask a question?
Yeah, I got a question.
Yeah.
Maybe we have the same question, Brian. Why 10 to 90 and not 0 to 90?
Because I did not want to bring him through the extensor mechanism at the end there. Also, like, I don't feel it necessary from a torque production standpoint. Like, I don't think he's going to be generating enough torque at that range for me to find it worthwhile using it. So I don't want to tread in that water if I don't have to.
Fair.
And then my question is different.
Yes.
Why 1 minute between sets? Why not longer if you're getting true eccentric loading?
So this is a time thing. I'll also go into, yes, it is eccentric training. But I'll discuss in the next slides how it's not so much like 100% each one. Because if it was that, I would take the rest up and probably decrease the reps. It also is a time thing, I'll admit, just because the degrees per second is very slow to where this whole intervention will take a good 12 to 15 minutes ish. So yeah, that's the rationale, and I'll get into it a little bit
Yes.
more here. I think on the
So
next slide.
you're not saying that you're doing a quasi isometric. It's like true eccentric. He's giving into it. You know what I mean? Where like a
Yes,
quasi
yes. So,
isometric is, whereas like he just pushes until it breaks and then he eccentrically loads through it.
correct. Yeah. So he's loading through it the entire way, and
Okay.
so I have it put here that I'm trying to improve muscle strength, but also bigger, providing that qualitative report of deficits throughout the range of motion. So I say I'm trying to improve muscle strength, and like I would say I am, but it's more so maybe linked to like that neuromuscular control and like him getting comfortable producing torque through that range and going through there. Also a anecdote, we're pairing this up with him just doing isometrics in that range that he is not comfortable in, but it's a PIMA. So he is pushing as hard as he can into it. This is just more so getting him comfortable when his knee is bringing into that flexion, because we'll see here on the. All right, I'm just going to skip to it to show you. It's not pretty, as you can see. That should be we're looking at the right one here. That should be a smooth line going from bottom to top there, left to right. And you can see in the middle there, it's quite junky, but we'll come back to that. So we started off at 10 degrees per second. So a total of 8 seconds to go through the entire motion, which, yes, that's a long time. And yes, that would be a very long time if you're doing a true supra physiological maximal eccentric. Like if he was giving everything he got, that is a long time. And you would probably only truthfully get like, I would argue 3 to 4 reps of like actual true output before your muscle is like, I'm done with this. But so after the first session of doing this, he felt like it was too slow and wanted to go up faster to 20 degrees per second. Well, we brought it up, and you'll see in the graphs, it really started to space things out even earlier. And my hypothesis is that he is able to retain a pretty smooth curve for the first few degrees up till around 50 degrees of knee flexion. But if he is moving faster into flexion, I believe there's probably a quicker variance of him being like, oh, I don't like this. Let me start letting off now. While if it's going slower, it's a more gradual, like, oh, okay, this is where it's starting to, but I can still keep on giving some. And then the time for uncomfortability in the range of motion starts, in my opinion, to get narrower the slower you are, because there's a more feeling of control at the slower speeds. And then we also lengthened his rest a little bit to 5 degrees per second, just because he was feeling a little bit more fatigued by the end of each set. So whether you increase the sets and just decrease the reps, do it that way, or in this way, I just decrease the speed because I already was in the program, so I couldn't change the reps and everything else unless I want to cancel it all, but I could change the speed. So that's why. So also, this is a big thing because this would also apply to like if you're doing strength testing that we talked about in the first episode, where cueing is very important, to where I was telling him to apply as much force as he can while maintaining as smooth of a curve as he could, because I'm not too worried about what's essentially his peak going to look like for that entire curve, because I know it's going to be garbage. I know it's going to be bad. Like I already know he has a deficit. That's not going to magically become this beautiful curve. after just like 2 sessions, And so from like a neuromuscular control output, I wanted him just to feel comfortable putting as much force to where he could keep that as smooth as possible to then just, get that knee through that range outside of a closed kinetic chain fashion. Because that's the thing is he can do lunges and everything else. And you would be like, oh, he looks fine with this. But then you get him on this and he is very avoidant from going through those ranges. And he does, post when he will do like deeper knee flexion, like slower walks or like sled push and pull. So clearly he does not want to be there. So this is what it looks like.
I have a question on that too, just because my assumption from the cue is that he can like watch these curves that we're going to see in the next slide the whole time.
Yes. I face the computer. Yes, I turn the computer screen towards him so he can see the curve himself. He'll intermittently look, like he doesn't look at every single one, but he'll usually look at like the first one during the set. And he'll see it, and then he might like look down just from like an effort standpoint, because I give this guy a lot of credit. Even though I tell him to just give as much force that he can maintain the curve, he's one of those guys where he just like he's gonna go full bore, and then it's like he gets to that range and it's like shuts off. He doesn't want to do it, and then he'll like, you'll see in the curves, he'll go right back up to where he left off. It's just like that little range in the middle. He does not want to produce anything. So really trying to reiterate to him, like, smooth this out. Like, I want this to be as smooth as you can the whole time. I want to see this curve not be so undulating or, wavy. So
now I have a second question.
Yeah.
It would be nice to see the graphs.
Yeah.
Can you so like for the super wavy one, could you use another visual aid to help with the like keep the thing as smooth as possible and be like keep your force, like you can put like a bar across where you want the force to be and like keep your force within this bar?
Yeah, so there are different like game modes through the HUMEC norm where you could do a like a road essentially, where you have to keep the force going through that road. There's also a like a Pong game. That one is a little bit more like isotonic, to where they're like having to pull and push a certain weight. So that one's maybe not the best example. But usually it's done in an isometric fashion. I don't know about, it's either isometric or isotonic. It's you either preset the weight and they move it, or they just stay in one position and then their output will change what's on the screen. I would have to check in again if there's any kind of game modes for the isokinetic stuff, but yeah, I can't say, but I see what you mean, trying to like gamify it a little bit more that is maybe a little bit more digestible for patients.
It's probably just easier just to follow.
Yeah, just to like, because clearly he's not doing a good job keeping all the curves looking the same too.
Yeah, correct. And I think, there are some examples in here where like, if you see this, do you guys see my mouse?
Nope.
No. Anyway, all right. So if you look at the picture on the left, there's that little spike right around the middle of the chart. And that is one of the curves where he really tried to gusto it pretty close to where he was about to possibly have pain. And then it just dropped, and it kind of gets lost because they're all blue, but it drops and then he'll get back up to it again by the end. And then on the second slide here on the right, this is the one that he wanted to do it at a faster speed. So 20 degrees per second, he would get through the motion at half the time as the last session, because it would only be 4 seconds. And that's where I feel like that initial almost like a paintbrush look is coming from, where he might be giving less, and it might also be a fatigue aspect, jury's out on that one also, but because every photo, as you can see, is from the last set only. The reason I chose the last set was because these were his best results across the three. Usually the first set is like pseudo warm up getting into it. Second set, he's like just getting the hang of it. And the third set is when he really starts to show progress, at least from the next two slides we'll see here. Any questions on
Also,
these?
yeah, just to make sure I'm reading it right, the on each picture, the left graph is the graph of his rest.
Correct.
Okay. So that
Yes,
little spike is when it's like about to go back and he's like pre-pushing into it. Like at the end of the left graphs, you see how it goes like whoosh, right at the end.
No, my assumption is that's him getting into the rest, and it's him like just taking off the gas.
Oh, okay.
Like that.
Gotcha.
That's him like recognizing that it's going the other direction now. It's like, oh, I can rest now.
Yeah.
Ooh.
Yep. Okay. And then my other question is, do you care about the numbers below the graph at all with these?
So I was gonna get into that. You're getting ahead of me, Mike.
Yes.
I mean,
Okay. Sorry.
I mean, there's a lot of red. There's a lot of red.
There is a lot of red, but the red does get better ish.
Okay. Yeah, let's see it.
All right.
There's
so
less
all
red.
right. Let me clarify again. The one on the left is day 1. The one on the right is day 2. The one on the left here is day 3. The one on the left is day 4.
Yo, he's getting better.
Now, okay. I don't need glasses,
but there's still is that still just the two different speeds though? Are we looking at the same?
We're looking at the same speed. So, okay. Good point, Brian. So, day 1, 10 seconds rest, 10 seconds. Sorry. Yes. No, 8 seconds rest, 8 seconds of work.
Yeah.
Day 2 is can't do math. 20 seconds. Sorry.
No.
Yeah, I see the speed says 5:10. Oop, what just happened?
You skipped it. Anyway, so yeah, so sorry. Well, in any case, the second day, slower rest, faster contraction. These last two goes back to the 10 degrees per second. So the same as the first day. He does get more rest though. So that is a good point. He does get more rest. And I do, as I was putting together this, I did realize it. It's like, okay, there are a lot of things changing for just having 4 samples to show. I understand that. But I would argue that this last result here, even with the rest being increased, is quite significantly different qualitatively than the first day of training this. Yeah. Now, whether that be a fatigue thing, I don't know, but I believe in my heart, like even just looking at the CV, if you look at the CV on the peak torque, and I understand these are average values, so take that with what you will. It's not actually like the true peak, but the CV for the first day was over like that 10% that most people have as their mark, And then
that's a 0.48, just so I'm make sure I'm looking at the right thing.
Oh, sorry. No, that is the 0.14. Yes. So
okay.
The flexion is actually the eccentric east extension.
Okay, that's all we're looking at there. Okay.
Yes. Don't worry about the left side of that. We're just looking at all the right side.
Okay. Gotcha.
Yeah, so we don't need to look at the extension portion of it. It's more
no.
Gotcha.
Yeah, which I understand is like, ass backwards, but just because this is the preview of it all, and I like how the preview gives me these little curves, the qualitative curves. I've tried going back after previewing it, and it gives me bars instead, and I'm like, well, these bars tell me nothing. They just tell me the whole output, and I've tried everything to change it, and I've yet to find it. So this is what we get.
Gotcha.
So as you see, the CV, it did go down on that second day. But then it kind of went back up on the third, and then it went down dramatically, and the actual like average peak went up on the last day as well.
So that's
the
day 4.
123.
Yeah.
That's the 123, correct?
Yeah.
Okay.
At a 0 or 0.05.
Yeah, exactly. And like I would argue that is not obviously a great curve still. Like there's still a lot of fasciculations going on, but you can see the representation of what that's supposed to look like as compared to day 1 and day 2. Day 3, you're getting there. There's still a lot of spikes. And then, yeah. So we're smoothing out the curve, and I like it. I like where it's going. You could look at the work per rep. That is the second of the torque parameters. Just because I believe this is going to tell you how much is being done underneath like the entire curve. And
So
yeah, Mike?
on in this slide, the left one, that's the 93.
Correct. Yep.
Okay.
Yep. So yeah, so there you go. It goes up, and I believe this goes up because of his curves getting closer, thus him not having spikes going downwards. So he's keeping his torque higher the whole time. Thus, his total work per rep is probably going to go up as well, just because he's not going back down. You know, like he's able to keep it going up. So
Now, Mike,
yeah, what's
I
up,
guess
Brian?
my question is do you think this individual is just getting a testing effect more than anything else? Because obviously you're going to throw out the second day to comparison because it's at a different sort of,
speed.
I guess, speed.
Yeah.
But then obviously there's a fear factor where this guy's like, I don't know what we're doing. What are we doing?
Yeah, exactly. And I think this goes back to our conversation from episode 1, where if this is a testing effect of where we're just doing the test and he's getting better at the test, if it translates to improved function, I would argue, does it matter? You know what I mean?
So then my next follow-up question is what function are you seeing improvement in?
Yeah. So he is having, well, I guess all PTs, you know, everyone comes in with pain. So I feel like that's always like a good marker to say, like, where's his pain going? He has been saying that his pain is changing and getting better, to where his pain was very localized when he was doing the exercises the first time. And now it was very localized and intense. And now it's more like diffuse and just feels like pressure. And I think that's a positive, outside of like having something that feels like you have a knife going into your knee. He's still having the posting. So that is still like, if we're saying like function, still not improving. But I guess I have not taken him through what might be like, quote unquote, like functional testing yet, because I know it's just going to look like garbage still until we get his peak higher. Does that make sense? Like,
so then why not test it? I'm challenging that.
Yeah. Why not test his peak? Is that what you're saying?
No, why not test his that functional testing that you are like not wanting to go through, because he may be good at functional with whatever.
Yeah.
You're just kind of, I mean, I think we chase numbers sometimes and then we just hang our hat on a number, but they may be functionally better.
Yeah. I would argue that, well, I guess, oh, here we go. Rabbit hole time.
Yeah. Let's do it.
What is a functional test? You know, like I know I just used the word functional testing and I did not tell you what that was. What is that? That is for, you know, whoever you are deciding. For me, I would say functional testing would be running for sure, cutting, seeing what, like, how does cutting look and how does deacceleration look. And I know that's not like a test per se, but still qualitatively seeing and getting report back from him on how that has changed since starting rehab. But I do not think that is at a point yet to where I'm going to get any information that is going to change what I'm currently doing, based on the fact that we are still doing very slow velocity, like sled push, sled pull, and then partner. Like, I don't know if you guys ever done this, the power bands in between you and someone else. And then you get into like that squat position and they pull you and then you pull them. And essentially you're having them bring their knee over the toe as they go forward and you're pulling them forward essentially. And every time it's just, he's posting just like straight out of it because he does not want to retain any kind of deeper knee flexion angle in a, you know, quote unquote athletic position that might resemble something when you do go for cutting or DXL, and so forth. So
I have a question on these functional tests too. Sorry if you want to finish your thoughts.
Well, I don't necessarily think these are like, I guess, testing in this.
They're functional testing because it's that person. That's what they want to do.
Yeah.
Yeah, that's what I was gonna ask. Is like, is this stuff that is like relevant to him? Like, he wants to get back to running and cutting things. Like, one, does he need to do that for his job? Two, like, does he want to like play soccer or something?
Yeah, he is very recreationally active, and so it is something that he would like to get back to. Especially the running one. I think that's like top priority for him. Like trail running and such. Yeah, go figure, right? We just if anyone has not listened to the episode that's about to come out, or I guess it has come out at this point, Mike just loves running and he brings it up a lot. But yes, so where were we? Running is top priority from my understanding. And then just being able to participate in recreational sports is like next to that. He's not in any clubs, but he just would like to be able to participate in them if the opportunity arises. You know,
he wants to play pickup or something like that.
Yeah, exactly.
I mean, is this individual? So this individual is not running at all.
No, they are currently running, but not much because, like most runners, they're just going to keep on going, you know? So,
but he's been limited by pain or by function. I guess you would put that word out there again.
So, yeah, I guess pain due to the fact that if he goes running for, 2 miles, he would just have to stop. Or let's say he goes running and he's feeling good on one day, then the next few days he'll just be in significant amount of pain because he did like too much for what his knee is able to handle right now. So,
I mean, I would stop at 2 miles.
Yeah. So, I think this upcoming week we are doing his isometric testing again. So fingers crossed that his peak values look better coming out from there. Because I do believe like his just capacity for knee extension is just so low that I could coach him in any means necessary. Like I could be in his face coaching him on not to post during a sled push or sled pull, but it doesn't matter because he just doesn't have the knee extension to not do that, you know? So we'll see. Fingers crossed. Hopefully it looks good. I think it will based on what's going on right now, but we'll see.
Sweet.
Yeah, man. Let's see. Oh yeah. And that's about it.
Cool.
That's,
I like
yeah.
it.
Any other questions about anything? Sick.
No, yeah. Sweet.
Sick.
So yeah, that's another episode of now our data nerds coming out. Hopefully people enjoyed this, and if they do, be sure if you're listening to this on Spotify or Apple Podcasts or wherever you listen to podcasts, please watch or at least like look at the YouTube, because we reference the graphs a lot, and so I feel like you'll be very confused not being able to see those.
Might have to put a disclaimer at the beginning of this episode, like a verbal disclaimer.
Yeah.
Warning, go to YouTube.
Hopefully I did that. And yeah, if you enjoyed, follow us on Instagram at Reading Rehab Pod. Thanks.